Apasen was formed by a group of parents with the help of social workers at the Beatrice State Special School in Tower Hamlets. 40 families were visited and an interest in meeting together was keenly expressed by them. 10 parents came to the first meeting. The number of parents attending the weekly meeting of the group began to increase gradually. The group had drawn up a constitution for the organization and elected a committee to run it properly. Apasen is one of the leading charity organizations working for autistic people with learning and multiple disabilities, their carers and parents in Tower Hamlets and Greater London since 1984. Over the years, Apasen has been working on improving the quality of the life of people with learning disabilities and to empower their families and the youngest able adults, especially in terms of health and education. We offer a number of services that include home and community services, opportunity zone, day services, information, advice and advocacy, Apasen Lodge, respite care, Apasen Training in Social Care, ATSC. Apasen has become one of the leading service providers to vulnerable people in the community. We are always committed to value the views of our service users and learners in order to ensure that we take initiatives to meet the needs of those people.
Right from the beginning, Apasen has been refining its plans to serve the community, working with key partners, social workers, commissioners, NHS, clinical commissioning group, and listening to feedback received on emerging COVID-19 issues.
We had a very difficult year, well over a year, and we faced some really difficult challenges with our service users. And we had to come together as a team to ensure we overcame some of these barriers. One of the things that we did to overcome these barriers was to come up with innovative ideas to so that clients can continue accessing the community and also keeping in touch with their family. And we did this through various ways, and one of them would be online activities or keeping in contact via iPad and FaceTiming.
Apasen provided updated risk guidance and adequate hand sanitizers, gloves, aprons and other PPE in a timely manner.
Some of the challenges that we faced during the course of the pandemic was keeping up with appointments and the lack of appointments that we had, and we had to adjust very quickly to phone appointments. So our staff and our management team were very helpful, particularly Pamela was really helpful. We had to pay a lot of attention to detail in describing what was wrong and what kind of help we needed for our clients to get the best kind of help that they needed.
At launch, Apasen identified the high recipient clients who are entirely dependent on its care. We have categorized the care needs of people using our service into a traffic light system: red, amber and green. This allowed Apasen to focus on dependent where priority has been given to the most vulnerable people. We always complied with official advice, including guidance for social or community care and residential settings on COVID-19 published by Public Health England.
We've had some good feedback from relatives over the information that we've kept, informing outside people like relatives and friends, what was going on at the lodge during this time. So we kept that going all the time. We would send out this information via newsletter. With this, we have learned a lot of things. And with this information that we have gathered, we're able to use this to improve the service going forward.